why don't we get started so we're, so we take good use of all of the hour. I want to welcome everyone. My name is Dr. Charles Fuchs. I'm the director of the Yale Cancer Center and the physician-in-chief of Smilow Cancer Hospital. And welcome to our Patient Family Forum, Partnering in Your Care. This is actually the third of our patient family forums that we initiated during this global pandemic, with the goals of keeping the people that we serve, our patients, families, and community, keeping you informed about what we're doing, how we're ensuring exceptional, outstanding cancer care throughout this time, and how we're keeping patients and families and our staff safe in the process. And I want to, before we get started, just introduce and thank my colleagues who are joining me this evening. And while I call your name, why don't you wave so that people know who I'm describing on the Hollywood Squares panel that they're probably looking at. So I'll start in no particular order. I'm joined today by Kim Slisser, who is the Vice President for Patient Services and our Chief Nursing Officer for Smilow Cancer Hospital. Tara Sanft, who's the Chief Patient Experience Officer, Director of the Smilow Survivorship Clinic, and a medical oncologist in our breast program. Lisa Barbarata, who's Program Manager for Oncology Nursing Education and Practice. Sarah McGallion, who's our Chief Ambulatory Officer for Smilow Cancer Hospital, and also a medical oncologist in our breast cancer program. Connie Smith, who is the Director of Oncology Social Work. Ann Chang, who is our Chief Network Officer for Smilow Cancer Hospital and a medical oncologist in our lung cancer program. Maureen Major Campos, who's Director of Ambulatory Patient Services. Anamika Katuk, who is the Medical Director for Smilow Cancer Hospital Care Center in Waterbury, Connecticut. And James Yu, who is the Medical Director for Smilow Radiation Oncology and a radiation oncologist providing care in our Department of Therapeutic Radiology. So let me sort of share some slides with you as we start. And you know, our agenda for today is, beyond some introductory remarks that I'm going to offer, includes an update on our ambulatory care program, how we're addressing patient safety and testing as we continue to address.
Charlie, we're not seeing your slides.
You're not seeing my slides?
No.
Yeah, you're right. It's funny. It says it's sharing the screen, but let me start again. Does that work? No.
Yeah, Charlie, you sometimes, if you have multiple things open, you have to select your screen, which screen you're going to share.
Sorry for this technical difficulty, everybody. Try this. How's that? Does that work?
Yay. There you go.
Okay. I don't know what I did, but it worked. So our agenda is an update on ambulatory care, on patient safety and testing, patient support from Connie, and then Tara will moderate a panel discussion with the entire group to address your questions. And so if you have questions, you can submit them while we're ongoing, either through canceranswers@yale.edu or by clicking on the Q&A function in the Zoom chat, in the Zoom function, rather, the Q&A function. So we've gone through an extraordinary period of our history as a nation and as a world. Obviously, this pandemic has had an enormous impact on life around us in our community, with an extraordinary peak across the country, particularly in the Northeast. And what we're very fortunate now to experience is a continued decline in the number of cases. And I think we're on the better end of this pandemic, such that things are now reopening across Connecticut, New York, Rhode Island, Massachusetts, the communities that we serve. As many of you know, we are at Smilow Cancer Hospital and Yale Cancer Center, a National Cancer Institute designated comprehensive cancer center. That is a designation that is only granted to about 40 centers across the United States. We're the only comprehensive cancer center in the state of Connecticut, serving throughout the region to provide cutting-edge clinical care, groundbreaking clinical research, education, outreach, and that's something a mission that we're devoted to, and I'm so pleased to say we're devoted to throughout this pandemic. And I'm so proud of the work that all of our staff have done throughout this time to keep our patients safe and to preserve the sacred mission of providing outstanding care to our patients. And I think the experience of our patients has been one that's continued great care in a safe environment, and one where also we have ensured that our patients are safe. We have so many healthcare heroes that we want to thank. Many of them are on this call today. And we also want to recognize the extraordinary courage of our patients, who each day inspire us and for whom we are so privileged to work with at our cancer center. You know, we now, as we sort of get back to returning to full operations, and I want to point out the fact that we continued to provide cancer care throughout this period of time, but we obviously are bringing back all our services back to the sort of normal state. We have what we refer to as our transformation team and work groups, because as we resume full activities in our cancer center, we also want to take advantage of the fact that we want to look carefully, are we always providing care in the most innovative way that provides the best experience for our patients? And so we have work groups on the inpatient side, on the outpatient ambulatory side, in terms of how we provide supportive care. And no less importantly, how we deliver clinical research, how we avail clinical trials to patients and to work across all of our departments to do it. I will say that on the clinical research side, you know, we've had to put a bit of a pause in terms of our clinical trial work, but I want you to know that research is resuming. And really, even during this period of time, the great work at our cancer center has been recognized. The Oncology Nursing Society, which is a major international meeting, our nurses at Smilow submitted a number of key research and care innovation breakthroughs. A number of them were recognized at that meeting, which will happen in a virtual forum down the road, but it's just a real credit to our nurses. And I want to share some other recent developments from our cancer center that were presented just last week at the national or the international major cancer meeting, otherwise referred to as the American Society of Clinical Oncology. Two important breakthroughs of examples I want to share with you of the work that continues to go on today. So prostate cancer, a major cancer that affects hundreds of thousands of men worldwide. A lot of good treatments going on, but clearly a need to further improve the care for men with advanced prostate cancer. A scientist by the name of Craig Cruz here at Yale discovered a way that he could create a drug that would select a protein and destroy that protein, otherwise referred to as protein degradation. And so if you knew that there was a protein that was critical for a particular cancer, he can now create a drug that if you take, and you take orally, it will destroy that protein and then damage the cancer because that protein is so key. And what he did is he developed a PROTAC, a protein degrader, against something that was key to prostate cancer cells. And that PROTAC, or that oral drug, then led to a clinical trial led by Dr. Daniel Petrolak here at Yale. And that phase 1 trial, which was just reported last week for men with advanced prostate cancer who had progressed through all available therapies, that drug actually led to reduction in cancer in several men. This is early work, but I will tell you it's a really important finding because this is a whole new avenue for cancer therapy, that where we could selectively target a particular protein that not only selectively kills the cancer, but actually potentially reduces side effects from cancer because it is so selective. And I think this could open up a whole new avenue of cancer therapy for a variety of cancers. As well, we've had great success from the leaders of our lung cancer program. Dr. Roy Herbst, who leads our program and is the chief of medical oncology, led a large international study that was led at Yale of a drug called osimertinib, which is for a particular type of lung cancer those cancers that have a mutation in a gene called EGFR. And what he did is he took individuals with lung cancer who were undergoing surgery in an effort to see if you give this drug, this pill after surgery, can you improve the cure rate with surgery as opposed to surgery alone. And the trial was completed. It was reported out last weekend. And what did they find? They found that the individuals who got this drug had an 80% improvement in their disease cancer-free survival. Let me tell you, that number is staggering. We've never seen a number like that. Successful studies in this space have maybe a 30 or 40% improvement. This is really a groundbreaking landmark study out of our center, and we're so excited. Dr. Sanft, who leads our cancer survivorship program, can tell you more, but this week is Cancer Survivors Week. We celebrate our survivors. We had planned for a in-person event, but Dr. Sanft and colleagues are having a series of online virtual forums, and we encourage you to participate in this. One thing we want to get across today with our forum is to communicate to you the importance of returning back to the cancer center. If you are concerned about cancer, if you're being treated for cancer, don't let that go unchecked. Why do I say it? Because this was a headline from January of this year. When we reported our cancer statistics, we saw that we had the largest reduction in cancer mortality in the United States ever. Why? Because of screening, prevention, treatment. Let's not lose that progress. So come back. It's safe, and as you'll hear from my colleagues, we are open for business, and we are providing this continued state-of-the-art care in a safe and protected environment. And, finally, I just want to conclude, because I'd be remiss not to also recognize the events that are going on in our communities, our nation. Sadly, the senseless murder of George Floyd has brought again to the forefront the longstanding issue of systemic racism and racial injustice in our country. And, as a community of caregivers and researchers and educators here at Smilow and Yale, we are committed to the common humanity that holds us together. And not only are we focused on defeating cancer, we have a duty and a responsibility that's equally compelling. That is to eliminate injustice and intolerance that both shorten the lives of individuals and limit the potential for so many. At our center, we are intensifying our focus to address the issues of racial inequality that affect our entire community. And together, we are committed to our commitment to diversity, inclusion, equity, social justice, to ensure that all individuals, regardless of race, creed, identity, will flourish in our community. And we all look forward to working with our colleagues and with all of you on this very important effort. So let me stop there. I know I ran a little long, but I'm now going to turn it over to Dr. Sanft, who's going to moderate the rest of the forum.
Thanks, Charlie. Those are really nice words and a great way to open this up. We would like to hear now from Dr. Sarah Mugalian. She is our Chief Ambulatory Officer, and she and her team have moved mountains literally across the state and back again. So Sarah, why don't you update us on your transformation?
Thanks, Tara. And thank you, Charlie, and all for the opportunity to speak with everyone this evening. It's great to see so many people online and live and on Facebook. As you mentioned, I'm a member of the Ambulatory Work Group, which is led by Maureen Major-Campos and Ann Chang, both of whom are on the panel this evening. Let's go to the first slide. I think I'd like to start by saying that earlier this year, we were all overwhelmed by COVID-19. It was new, it was scary, and we quickly needed to come up with solutions to continue to care for our patients with cancer. Over the last couple of weeks, however, I've developed a new perspective, and I'd suggest that we can reframe the experience. What started as a public health crisis may actually lead us to transform the care that we provide. As many of you likely know, many of our practices relocated for a couple of months in the middle of COVID-19. Several of our care centers joined forces into one physical location. Many of our New Haven-based ambulatory clinics moved to Guilford, North Haven, and Trumbull. However, as I'll show you in just a second, many of our clinics have now relocated back to their original spaces or more spacious temporary locations, and we can now start getting down to the business of transforming our care. So we're in the process of ramping up our visits in clinic, all while maintaining social distancing. We're addressing the backlog of patient visits that were canceled or postponed during COVID-19. We're going to optimize our schedules, our clinic visit times, our clinic hours, and we're working on ways to enhance the patient experience using technology and touchless contact before and after clinic visits. Next slide, please. Just to give you a sense of all of the moving parts, in the last week, the Breast Center and Gynecologic Oncology programs have moved from the Shoreline Medical Center in Guilford back to space in the North Pavilion on NP4 and NP8. We've kept a couple of groups, namely neuromedical oncology, GI medical oncology, liver, and the thoracic oncology program at the 6 Divine Street location in North Haven. The Fairfield Care Center, which had been previously merged with Trumbull, is now open 3 days a week. And starting next week, the Orange Care Center will reopen full-time. Next slide, please. I don't show you this slide to get into the details of the data, but I do show it to demonstrate that we've continued to provide care for our patients. We saw initially a sharp decline as COVID-19 hit very suddenly in our in-person visits, but over the last few months, we've restarted, or we have continued to see patients both in person and via telephone and video visits. And with the incorporation of technology-based visits, we're now seeing close to the number of patients that we were seeing prior to COVID-19. Next slide, please. As we now have the opportunity to move forward, we have a central guiding principle. We need to keep our patients and our staff safe. We know that patient visits are going to increase as screening tests, procedures, and surgeries come back online. We also know that in-person clinic and treatment visits are absolutely critical for many of our patients. And finally, we've adopted a number of strategies to achieve social distancing, namely minimizing physical contact between patients and staff and time spent in waiting rooms. We've extended clinic hours to reduce patient traffic. We're cleaning and disinfecting after every patient. We have mandatory screening both on the phone the day before a visit and at the time of the visit upon arriving to the building. All of our staff and patients are expected to wear face masks. And we have a separate treatment space for patients confirmed to have COVID-19. So they're not being treated in the traditional clinic setting. Next slide, please. We've developed a number of guidelines to help us achieve social distancing in clinic. And I show you this schema just to demonstrate the complexity and the number of steps that a patient must go through to see a physician, to have lab work, to receive an infusional treatment. And each of these stops requires the wait time. It can result in patients gathering together. And we've put in place a number of guidelines to minimize wait times and to minimize the number of patients in any waiting space. So for example, fewer patients are being scheduled per hour. We're continuing the robust telehealth practice that we've developed over the last few months. We've extended our clinic hours from 7:30 to 5, including over lunch, which we traditionally have kept as a break for our providers. Infusion treatments are now scheduled across the day, rather than being primarily in the morning. We've asked patients to have their labs drawn on an off-site location, prior to treatments to avoid waits at the lab. There are fewer staff on site in clinic, and we have a continued no visitor policy with, of course, a number of medical exceptions. Next slide, please. I think with regards to telehealth, the use of technology has really become transformative. We now have this wonderful opportunity to redefine and optimize the way we deliver cancer care. It can be done from anywhere, and that's convenient for you, but it also limits the number of patients within a clinical space. It's going to become a critical component of the care plan for many of our patients. You should know that we're working to improve telehealth technical support resources, both for patients and providers. We're working to enhance the staff support during video visits. And just a quick heads up, a new video visit platform with more features and capabilities is coming in the next few weeks, so stay tuned. Next slide, please. Anyone who is interested in having a video visit these are some of the things that you need. You need just to have a smartphone or a tablet. You need to have a MyChart account with the login information, and you need to have the MyChart app downloaded onto your smartphone or tablet. It's really quite easy. Even some of my most technologically unsavvy colleagues have been able to figure this out. So it's pretty simple and it works very well. Next slide, please. If you need any help, there are a number of resources available for you to access to try and get this up and running. Next slide. I would be remiss if I didn't mention the Patient Family Advisory Council. These folks are involved in all of our major initiatives and really serve as the voice of patients and family members as we try to roll out new things, as we roll out new initiatives, new projects across the Cancer Center. And we legitimately could not do anything without them, so thank you very much. Next slide. So the take-home messages are few. We've continued to see patients with only a small drop in the overall patient volume. We anticipate that visits are going to increase as as surgeries and screening procedures come back online, and as we start to address the backlog of patients, those who had appointments who were delayed during COVID. We're going to start slow, but we're going to build up very quickly and to support social distancing with measuring and assessing every step of the way. We anticipate that we'll be adjusting things in real time from day to day, from 1 week to another. Telehealth is not going anywhere, and I'm really excited to have this opportunity to bring that into cancer care delivery. And the collaboration of all of our staff, all of our patients, is what makes Smilow Smilow, what makes us a very special place to receive treatment and to work. Next slide. Just a quick thank you to everyone who's been involved in all of the moving pieces, all of the initiatives, the moves over the last couple of weeks and months. We really could not have done it without you, so thank you. I'll turn it back over to Tara.
Thanks, Sarah. That was great. Very informative. And, just your presence in the clinics has made our lives feel a little less scary sometimes. So thank you for all of your hard work, and you and Anne and Maureen. Your physical presence and your support has been really just very much appreciated during this time. So now we're going to move on to Lisa Barbarata, who is going to take us through some of the additional safety measures that are in place for the Cancer Center. Lisa is the Program Manager of Oncology, Nursing Education and Practice.
Good evening, and thank you, Dr. Fuchs and Dr. Sanft, for having me tonight. As Tara mentioned, I am the manager for Oncology, Nursing Education and Practice, and my job is really to ensure that the care that patients and families receive is safe and of the highest quality. And I think throughout the last 3 months, our goal has been to continue to provide that same level of high quality care, but with really an added layer of safety from every aspect. And Dr. Mughalian touched on several of these strategies that I'll spend the next few minutes going into a little more detail about. And so one of our primary strategies for ensuring safety as we increase the number of visits in our outpatient setting is really around screening. And we have 3 primary strategies to complete screening before visits. The first is a new strategy using MyChart, where a survey is sent out in advance of any outpatient visit for MyChart users, and the survey will ask questions about symptoms as well as potential COVID exposures. If a MyChart questionnaire is completed in advance of your visit, somebody will be looking at those results and assessing the response to that survey. If the survey questions were answered and there are no concerns, you will be able to proceed with your visit as planned. If the MyChart survey is not completed in advance or there are additional questions that need to be asked, you'll get a call from one of our staff who will go through those same questions in more detail and then make a plan with your provider around the safety of the visit given any symptoms you might have. In addition to those two strategies, we also continue to do on-site screening on arrival into any of our facilities. The on-site screening includes temperature measurements of anyone who enters the building, as well as questions about symptoms. If you have what we would consider a positive screen, which would include a temperature over 100, or yes to any of the symptom questions, a discussion really is had with your clinical team around what the safest next step is. That safest next step may be that your appointment is delayed or rescheduled. It might be that your appointment is changed to a telehealth visit, as Dr. Bugalian outlined, or you may be rescheduled for an appointment at one of our designated locations, which I'll talk more about shortly. If you have a positive screen, COVID-19 testing may also be recommended, which I'll talk a little bit more about in a few minutes. In addition to patient screening, we also continue to ask all of our employees to self-screen. And what that means is all of our employees are asked to continually monitor themselves for any symptoms of COVID, including fever, cough, shortness of breath, nausea, vomiting, headache, muscle aches, and loss of taste or smell. We also ask that employees check their temperature twice a day. And if they have a temperature over 100 or any symptoms of COVID, they're asked not to report to work and to report to occupational health for additional assessment and testing. So to talk a bit about testing, which is an area of a lot of discussion, employees with symptoms of COVID-19 will be tested for COVID, and they aren't allowed to return to work until they're deemed safe by occupational health. Additionally, over the last 2 weeks, employees who do not have symptoms also now have access to COVID-19 testing across the health system. As of Monday, over 1,800 employees have been tested, with a very small number of positive tests in asymptomatic employees. In fact, under 1% of staff who are asymptomatic have tested positive. What that means is that all of the strategies that I'll be outlining, specifically use of masks universally, as well as social distancing, have been extremely effective in limiting the number of cases of transmission across our locations. Patient testing I'll touch on as well. So Smilow Cancer Hospital is not currently recommending routine testing of asymptomatic patients. This includes routine testing before treatment in any of our ambulatory settings. We continue to closely monitor all of our testing data, the latest literature, and recommendations from experts, and continue to discuss this regularly and use it to guide our decisions to ensure we're delivering the safest care. We're currently testing all patients before admission through either our emergency room or any other method of admission. We're also testing before procedures that require anesthesia, including surgery and other high-risk procedures. We're testing patients based on risk factors such as exposure and any symptoms of COVID. Patients can currently be tested at designated ambulatory locations across the state and health system, and symptomatic patients can also be tested at the Smilow Rapid Evaluation Clinic in New Haven. We've implemented advanced cleaning and disinfection processes in all of our areas and are exceeding recommendations that are currently outlined by the Center for Disease Control. Hospital rooms are cleaned daily and deep cleaned after patient discharge. Exam rooms and individual infusion spaces are disinfected after every patient and deep cleaned at the end of every day. And throughout our locations, additional hand sanitizing stations have also been installed. Additionally, we have designated patient care areas where patients with COVID-19 are cared for. And this strategy allows patients without COVID-19 to continue to receive safe care while minimizing their risk for COVID exposure in our settings. We have dedicated inpatient units for patients with COVID-19, as well as a dedicated ambulatory location for Smilow patients, which we've talked about here before, called the Smilow Rapid Evaluation Clinic. Here, patients that are COVID positive can receive care as determined necessary by their medical team. And the clinic is staffed by oncology nurses and advanced practice providers with specialized training in both oncology and the care of patients with COVID-19. Additionally, for our patients, our Smilow patients who have been infected with COVID-19, we implemented daily monitoring calls to monitor patients for worsening symptoms and provide patient education on isolation and maintaining safety at home. These calls are made by a group of oncology nurses who have made over 350 calls to our patients to keep them safe at home and also facilitate in-person visits if needed. Over the next week, we plan to incorporate self-monitoring of oxygen saturation levels at home as an added layer of safety to our patients. Visitors, we continue to restrict visitors in both the inpatient and ambulatory setting. While we don't like restricting visitors and fully understand the impact of these restrictions on our patients and families and how difficult this is, it has really been a critical step in containing transmission of the virus. Requests for exceptions to the visitor policy are reviewed at the individual unit level, and exceptions are made based on medical necessity and individual circumstances. Surgeries and procedures, like the other locations I've discussed, our operating rooms and procedural areas have really implemented additional measures for stringent cleaning and sterilization. They've developed COVID-free surgical pathways to minimize risk and have added other strategies to limit the amount of people in waiting rooms, including use of mobile check-in and reducing on-site paperwork. Social distancing is really one of the most important strategies that we use to minimize risk, along with masks, which I'll talk about shortly. We have several strategies in place to promote social distancing, including limiting the number of people allowed in elevators, and we've minimized that number to 4 people per elevator. We really rely on all employees to help enforce this, to step off of the elevator to allow patients priority if the elevator is at capacity, and elevators are cleaned regularly. Common areas like cafeterias have eliminated self-service stations and have implemented stickers on the floor to promote social distancing and use of the 6 feet barrier. Plexiglass barriers have been installed at most of our check-ins. And as Sarah mentioned, we aim to minimize time in waiting rooms. And while we want you to arrive early enough to complete your screening, we really don't want you arriving more than 15 minutes before your appointment time to keep the number of people in any given waiting room to a minimum. We've also made individual modifications to waiting rooms, decreasing the number of chairs and increasing the amount of space in between chairs. As mentioned, some locations have also extended their hours of operation in order to decrease the overall number of patients seen in an hour. Next slide, please. Personal protective equipment in conjunction with social distancing is key to decrease the risk for transmission. Patients, anybody entering the building is expected to wear a mask that includes staff, patients, and any visitors who may be in the building. Cloth masks are considered acceptable to be worn by both patients and visitors and are also supported by the Center for Disease Control. Any cloth mask should cover both the nose and the mouth. If for any reason there's concern about the integrity of the mask, we will provide you a mask if needed, and if you don't have one, one will be provided to you. We will ask that you wear a mask throughout your time in our locations, especially when in close contact with your caregivers, and you will may be asked to remove your mask for important elements of your physical exam. All staff will be wearing a mask at all times, even in our common areas, and you may see staff wear additional types of protection like a gown and eye protection, which may be used for selected high-risk activities. Ambulatory considerations, I think Dr. Mugalian and I covered the majority of the strategies used, apply also to our ambulatory setting. Exam rooms are thoroughly cleaned. Radiology equipment is also cleaned in between patients. Our vital sign machines, any equipment that's in contact with patients is wiped down in between each patient. And then the last strategy, which Dr. Mugalian reviewed and the panel I think may touch on a bit more, is the use of telehealth, which we will continue to use as a strategy to decrease the overall number of patients in any one setting. So in summary, I've talked a bit about our comprehensive strategy to keep patients safe while they're here for care, while also continuing to provide high quality expert cancer care to our patients. All of these strategies have also taken a tremendous amount of communication and education. And I just want to acknowledge the efforts of the team on the call, as well as our nursing educators and our other nurse and provider leaders in helping to continue to spread these messages to ensure that all of our staff are well prepared to keep you all safe when you're coming in for care. Thank you.
Lisa, thank you. Wow, that was packed full of information, and I know that you and your team are always updating based on the most recent CDC guidelines and the newest research coming out about COVID as we learn about this disease. So I know you're on meetings from 7 a.m. until midnight probably. So thank you for giving us all of those key pieces of information, and I'm sure our patients really found that helpful. Our last speaker before we open it up to questions and answers is Connie Smith. She is our new head of oncology social work. Bonnie Indek has retired. Many of the people on the call may remember her. We're excited for Bonnie to move on to her grandchildren, and we're really excited to have Connie here. So welcome, Connie.
Thank you very much, Tara. I'm very happy to be here, and I want to thank you and Dr. Fuchs for the invite. I just want to kind of quickly share that, you know, part of the benefits of being part of a comprehensive cancer center is having some of the best care that you can receive. And certainly we treat our patients holistically, both medically and psychosocially. And that's where social work comes in. And social work, the social workers at Smilow are clinical licensed social workers. They're clinicians that are here to meet our patients' psychosocial needs. Definitely during the COVID pandemic, what we saw was an increase for psychosocial support to our patients. And social work definitely was up to the task. And we wanted to make sure, just like they were still continuing to being treated by their medical providers, we wanted to make sure that we were meeting their psychosocial needs and that they were going to continue to be seen and treated and provided support by the social workers. So that time during the pandemic, social work was really busy providing what we consider remote care. A lot of our social workers were still in contact with our medical teams. They were in contact with patients via the telephone. We actually, with the help of Dr. Sanft, implemented a program where we were actually making calls to our patients at Smilow and letting them know that we did not forget about them. We still immensely care about them and wanted to make sure that they were okay. Some of our patients, we realized, being home during the pandemic, could feel very isolated, like the vast majority of the population, but certainly, you know, some of our patients who are most vulnerable felt that they needed just having that someone to call and just check on them was beneficial. And so many of our social workers made many calls and continue to make those calls. So you might be one of the people who will see a call, you might actually receive a call if you have not already done so. And the purpose, just again, as an institution, to let you know that we care about you, and we care to make sure that you know that we want to hear your concern, want to hear if you're anxious about coming back into the care center. Certainly we want our patients to know that that's a real feeling, and we want to work with you on getting through that. But certainly we want our patients to know that we want you back, and we want to see you as much as we can face to face. The social workers are still going to continue to see patients, hopefully whether it's in our main campus on York Street or at the care centers around Connecticut. We have social workers who are very much waiting to meet our patients' needs. So one of the things I also quickly wanted to talk about is our support group. So social workers, we very much, again, try to meet the patients and to understand where the patients are. So we do have quite a number of support groups. And
Hey, Connie.
those support groups. Yes.
Sorry, there's a little bit of a lag with you. I hear some feedback.
I'm sorry.
That's okay.
I don't hear it on my side, so I'm not too sure.
Maybe if you speak slowly, at least then we can hear your full sentence.
Okay. So just want to quickly talk about the support groups. Many of our support groups are virtual, which is great because patients can participate from the comfort of their own home. And certainly we have many support groups. If people are interested in support groups, I would encourage you to reach out to your clinic or provider that can direct you to the social worker. I also believe the support groups are on Smilow's webpage, but certainly someone can always call me. I'm more than happy as the manager to take those calls. Because again, we want to make sure our patients are connected with all the services that they might need during their care here at Smilow. So I would just say to everyone, social work is here. We want to work with you and provide the psychosocial support that you need.
Excellent. And that was better. I don't know why I'm feeling like I have feedback now. So we're going to encourage the participants to submit any questions through the Q&A to thank our panelists for coming. Let's see if we can get a question that involves someone who hasn't talked yet. James, you from our Department of Therapeutic Radiation Oncology. Here is a question from a patient kind of talking in general about immunosuppression after radiation therapy. So he writes, I have recently completed radiation therapy for a recurrence of non-Hodgkin's lymphoma. I'm currently working remotely and a bit concerned, given my age, that he's going to be 65 and compromised immune system, about whether or not he should return to his office. So this is a tough question, but maybe you could speak a bit to your opinions on people who are having radiation and their immune status, and what have you been telling your patients?
Sure, and thanks for that question. I mean, it's a question we get asked all the time, even in non-COVID times. What does radiation do to my immune system? Can I get a flu shot? Can I be near other sick people? So in general, radiation does a lot of things to the immune system. Some of them beneficial, and some of them, we're trying to harness here at Smilow Cancer Hospital. But what radiation negatively does to the immune system, it does in two ways. By directly killing beneficial immune cells called lymphocytes, but also in the long term suppressing the bone marrow of a site if there's a lot of bone marrow being radiated. So radiation impacts your immune system directly in relation to how much of your body's getting radiated. So this person getting radiation for their lymphoma, if the lymphoma is in their little pinky, the radiation's not going to do a whole lot to the immune system. But if it's in a large area on their body with a lot of bone marrow, then radiation could reduce the immune system. But the advice I would give this person is there are other risk factors that you also have to take into account. Number one, they have lymphoma to begin with. They're, you know, close to the age of 65 or older. And we know that cancer patients are at higher risk for having problems with COVID. So my advice would be, you know, double down on the CDC recommendations for social distancing, be as clean as you can, you know, no high fives anymore, that sort of thing. But also really talk to your employer about maybe working from home even longer, because there are a couple risk factors in there. Radiation's one of them, but I would say in this case, it's minor.
Thanks, James. That was very helpful. Anamika, you're in the Waterbury Care Center, and I know Sarah and Lisa took us through a lot of the changes that we've seen throughout the system. Could you comment a little bit? A patient wrote in, are waiting rooms different now in the care centers? How is social distancing enforced? So maybe you could tell us a little bit about how things are for you guys out in Waterbury.
Absolutely. And that is a very good question, and a lot of patients are concerned about that. So as Lisa and Sarah already kind of said, those are exactly the guidelines that we are following. You know, all patients who come to the center are first screened at the door. We have masks to hand out to them. And you know, we have chairs that are all interconnected. So we've sort of covered chairs so that, you know, people cannot sit there. And we've staggered appointments. Each physician can see only 2 patients per hour. And because of that, you know, we've sort of decreased the inflow of patients at any given time. So we're, you know, trying our best to maintain, and we are able to maintain a 6-foot social distance. We make sure that our waiting rooms are not overcrowded at any time, or even crowded at any times. And I have to say that it has been working very well.
Excellent, thank you. Let's see, what questions are coming in? Here's a good one. So with regard to parking fees, I think either Maureen or Kim Slesser might be able to help us with this one. With regard to parking fees for Smilow patients who are dropped off at the Air Rights garage entrance, how can the driver avoid a $25 charge since the parking ticket cannot be validated until the patient gets to his or her appointment? So I think they're asking about like parking procedures that might have changed now because they can't park in Smilow and then walk the patient in to get the ticket validated.
Maureen, did you want to take that, or I'm happy to take it?
That's okay. You got it.
Okay, so that is a really great question, because I know a lot of our patients and family members are used to going to the appointment with the patient, and because of our visitor restrictions, that has changed. But yet our families are used to driving into the garage and then, you know, and then wanting to drop them off at that entrance. I just want to remind all the patients and families, we do have the main entrance still available in our circle, and I would really recommend family members dropping their patients off there, because there are also people there to assist, and the elevators are right there that can bring you straight to the clinic. So that's what I would recommend. If you do have to accompany your family member to their appointment, we do have some exceptions, and that happens really when we're doing our pre-screening phone calls to determine, and then you're able to accompany your loved one to their appointment. Again, all of our entrances have the screening, so patients and visitors are screened in no matter what entrance you go to, so you don't have to enter through the Air Rights garage to have the appropriate screening done. So that would be my recommendation, so that you don't have to sit in the parking garage until your loved one comes out from their appointment, that you're able to drop them off at the main entrance, maybe run a couple errands or go home for a short period of time and come back. But that's what I would recommend.
Thank you, Kim. Thanks so much. I thought I saw a question here, and maybe Anne Chang, you can help us with this. See if I can find it. It had to do with how are patients receiving the telemedicine visits, and what's the feedback been, and have they, what's your sense about how all of this, how they're doing with all of this? Of course, not under these circumstances. Maybe you could comment on any feedback you've gotten from our patients.
Sure. I think this is an example, as I said in my response to the great question, where the opportunity where this pandemic is really transforming our healthcare. So what we're learning is that now through telehealth, we can connect with our patients at home at a time when it's been very hard for people to leave their house and feel comfortable doing that. We have seen patients in Smilow who've come in for their treatments, but we've really been able to see about 50% of our patients in their home surroundings. And the feedback from patients and from doctors and staff has been really great. I've been able to see my patients, what's on their walls, ask them about it, see their pets, their families. It's kind of a zoo sometimes, and it's really, and I'm able to also evaluate if they have a rash they want to ask about, or just to see how they're feeling, if they're bright or if they're just not looking so good. But it goes both ways. Patients are happy to see their docs too and say, gee, how's it going for you? And we really appreciate your efforts. And I think it's been a way for patients to remain connected to their care team, but also for the care team to remain connected to patients, because you guys are why we do what we do. And so it's really important for us to be able to see you during this time.
Thanks, Anne. Maureen, tell us about how you see the staff doing during this time. And, especially the nurses and these our dedicated MAs and front desk staff who've come in day after day, regardless of what was going on in the world. How do you see them doing? What's been the conversations with them?
I think that has been the most remarkable part of this journey for me as a leader, is working with the staff and taking them through what was a very emotional time for the world. Energy into their patient care delivery, and to run towards patients and help them and ease their worry with whether it was a smile or a thank you, or how can I help, or let me take you to your next appointment, or calling them on the phone and saying we're here if you need something. I think that was the most remarkable part of my journey with the staff. I think that most of the staff, all of the staff, really felt that they were giving back to the world that needed them at this time. And so I think it's been a really remarkable time. There's been, I think about the early days of COVID, there was communication that was coming out that could have counteracted each other very quickly. The staff assimilated themselves, and some of their peers came down with COVID and struggled. And they not only gave to our patients, but they gave to their own community of team members. So they reached out, they created buddy programs and buddy systems where they would call each other to make sure that the disease or the illness was not getting worse, and that they were making good, sound judgment, clinical decisions for themselves. So, I think it's been a remarkable journey. I think people are happy that the information and the things have quieted down a little, so that maybe we can get to this new transformation. This has to be all worth something. And I think we're all putting our efforts and energies into that, including our frontline staff that are every day asking how we can make things better. It's a great question. Thank you.
Thanks for that. And then, we're almost at the end of the hour here. There is one here that I think maybe Anne or Sarah could take. As many Smilow providers have been relocated to the North Haven facility, please comment on how long that arrangement is expected to continue. So we heard about the services that have moved back. There's still some services who are displaced from their original home. Is this kind of what it's going to look like for a while, or what can you tell our patients about the rest of the services who left Smilow and are in their various locations?
I'll go ahead and take that. You know, it's a really great question, and one that we would kind of like to know the answer to ourselves. The reason that we're in North Haven is due to some hospital commitments for our space. We don't know what the plan is because we don't know how this pandemic is going to play out over the next several weeks to months. And we want to make sure that when we move back, we are moved back for good. So we've made extensive plans, put extensive plans into place to make sure that we have all the space that we need, that we have all the resources that we need to take care of our patients in every location, both North Haven and back at Smilow in the North Pavilion. I wish that I could give you a definite answer. I can't right now, but as soon as we know, we'll make sure that we communicate that to you.
Okay, thank you. Charlie, we have 2 minutes left. How should we close out the hour? You'll have to unmute yourself. Whoops.
Thank you. I wonder if any of our panelists or speakers want to, I know there's so many questions that we probably didn't get to. Is there
There's
anything?
a lot of questions. I'm trying to keep track of, we could try, we're going to try to copy and paste these and maybe we can answer them in writing.
Yeah. I was just going to ask if any of our panelists wanted to mention something that we didn't get to that you could think of that we wanted to cover.
Hey, this is Kim. I know with our physicians on the line, there were several questions about screening, particularly mammograms and things like that. If one of our medical oncologists could talk a little bit about how we're doing with that.
Sarah, did you want to take that?
Sure. Screening mammograms are restarting. All patients that had rescheduled or canceled screening mammograms from March onward are being contacted kind of in the order that they were canceled. So you should be getting a phone call in the next few weeks to reschedule that mammogram. If you have a specific concern or a specific date, feel free to call the radiology department to reschedule your mammogram, but screening mammograms are happening now.
Along that line, should patients be calling to reschedule appointments that were canceled, or will someone call them to reschedule?
I was in the middle of answering that question online, but
okay.
all of our teams have been keeping lists of patients that have been rescheduled or that have been canceled. So you should be contacted to reschedule your appointment. If you have a specific concern or a specific date or a specific issue that you need to discuss, again, feel free to call your provider's care team and we'll get that appointment scheduled for you as soon as possible.
Okay. Well, I thought we heard some really great pieces of information tonight. It was really nice to see everyone's face. You know, I've heard words like transformation, lessons learned, inspired, opportunities. You know, I think this is our third patient and family forum. We're going to continue to keep everyone abreast of the situation. And, you know, we look forward to getting, you know, the best care that we can with these circumstances, which is world-class care in a really safe way. So, Charlie, thanks again for letting me moderate tonight. Any other parting words before we sign off?
No, you know, thank all of our panelists. Outstanding work. And once again, thank you to our patients and the family members that continue to inspire us. This forum, for those for your friends who weren't able to join us this evening, it's available for viewing on video on Facebook and on our website. And I know at the last forum, I think over 1,000 or more viewed it online after. So for those who weren't able to make it, please tell your friends, colleagues that it's available for viewing after tonight.
Thanks so much, everyone.
But have a good night and stay safe, stay well, and we look forward to seeing you all.
Good night.
Thank you.